Thank you very much for the invitation for us to present to you. I really appreciate Mr. Lopez reaching out to me, expressing an interest in seeing how to identify vulnerable populations with cancer, cancer risks, or COVID-19. I also learned that you had interest in the work that we've done with the New York Times and other media outlets on health risks, and I'm happy to talk about that today as well. I believe that you will be able to raise your hand if you have questions, and I would encourage questions. I'm happy to answer those throughout the presentation. I don't think that it looks like we have 31 people on the call, so that if it gets unwieldy, we can save them to the end, but otherwise I think it's helpful to be able to jump in and ask questions. And Zen is going to keep an eye out for hands up so that we can try to be responsive. Okay, so I will get started. I am our Chief Data Officer at PolicyMap. PolicyMap is a 12-year-old data and mapping company, and we serve healthcare, government, nonprofits, and universities for data-driven decision-making. We grew out of a community development financial institution called the Reinvestment Fund, and we are now an independent benefit corporation, which means that we're a company working in the public interest. I'm one of the original members of the PolicyMap team, and I architected our data offerings and have collaborated on our product development over the years. Our data team's expertise is matched by subject matter expertise in areas of community health, community development, housing, and more. And our strength has always been in our data offerings, from gold standard public data sources like the CDC to data from private sources that we curate, like some data you'll see today, the New York Times COVID cases and deaths, to our own exclusive data that we develop, like small area health risk estimates that I'll show. And we blend all of these sources into PolicyMap for a seamless but well-documented experience. So I will get started showing you the tool. I think that you should be able to see my screen. But let me see now. Zen, are you able to see that?
Yes.
Great. Okay. Thank you. Okay. So we have data that we have been collecting and curating, ranging from demographic information, and I'll just click on some of these to show you, to incomes and spending. We have housing information. We have lending data, quality of life information like transportation and environmental risks. We have economy information, jobs and vacancy information. We have education data, including educational attainment and information on health. So this is where we'll focus most of our time today. And we also have federal guidelines information. So for organizations applying for federal funds, often these data sets are of greatest interest for compliance and for compliance as well. And then we also have our own analytics that we feature, ranging from our market value analyses in cities across the country to opportunity zone information. So we have quite a bit of data, and it can be hard to find in these tabs. So I'll show you also how to use our data search feature, which really helps with honing in on what you need. I will mention that we are in the final stages of upgrading our platform. So I will show you this demo today on our new platform that you're looking at right now, which you can tell is our new platform because it says beta here. And we're still rolling it out. So some of the features, like our data loader here, our reports, are coming soon and are now accessible through our legacy site that is still available, and you can get there from this link here. So I'm not going to demo all of these features because you had specific questions and I want to address those questions. But if a question pops up about either our data or our features, please do raise your hand and we will work on answering your question. So for our conversation today, I thought we could take a look at PolicyMap to look at vulnerable populations and risk. And then I'll talk a little bit about our work with the media, and I'll give you some takeaways at the end for your own work. So let's zoom into Texas on the map. And we can do that by entering a location in the location bar. Now, you can enter an address, a city, a zip code, or you can search by congressional district or metro area. So there's a wide variety of ways to search, but for simplicity's sake, let's just go to Texas where you are. And give me 1 second. I meant to close out of my email. There we go. Okay, so we're in Texas now, and I must admit I am not as familiar with Texas as I am with other places that I ordinarily demo. PolicyMap is based in Philadelphia, and I live in Baltimore, so I'm used to demoing on the East Coast, but I found it very interesting as I prepared for this conversation to look at some of the trends in Texas. And obviously, our tool is available for the nation. So if you have parts of the country that you're more interested in, you can just as easily go to those parts and explore there. So to start with, let's look at cancer incidence. So we can find that information in our health menu, or we can search up here. I'll go through the menu this time, which is health conditions. And I'll choose all cancers. And what you can see on the map, Kansas doesn't report data in this year, but what you can see on the map here is that the darker areas are those areas with higher incidence of cancer. So you can interpret what you're looking at here in terms of the rate, and you can see that these darkest purple areas have the highest. You can also see down here that the map is shading at the county level. So when we look a little bit more closely at Texas, you'll see that change as we drill down. You can see up here that the data is for 2011 to 2015. We're working on the update to 2012, 2016. And you can see that the variable here is the rate. And we're going to look at that instead of the estimated number. But you can toggle to other variables there. So if we hover over, as you may have noticed, we can see the cancer rate for Harris County, Texas. And if we click on the map, we can see more information, such as that Harris County is slightly higher than the state of Texas in terms of cancer incidence, and that it's slightly lower than the United States overall. If you want more information about the layer, you can click here in the I bubble. So try that to show you. We add a little bit more data, a little bit more detail here, and then you can click on our data directory to get more information about the source. So it brings you straight to the source. There's all kinds of information, including the geography that it's available at. And then down here, you can see in the description anything that we've done to the data. If we've normalized it or if we have added any other value to it. Often we do that. So this is our data directory. I also wanted to point you to our data matrix, which I can't access because, here we go. Our data matrix shows you every indicator that we have on PolicyMap, what geography, what year, and then it links also to our the data directory that I just showed you. So that's a little bit more detailed information about our sources. So going back to the map, we can look at, now let's take off the cancer incidence data and let's look at the COVID-19 cases. This is data that we get from the New York Times that they collect from all over the country. We assessed data sources of COVID cases and deaths and testing and looked at all of them and determined that this one seemed to be the most comprehensive, the most often updated, and we felt like this was the best representation of this kind of a map, this layer map called a choropleth map. So we can see the rate here, but let's change to what we're seeing in the news, which is the 7-day rolling average. And so I don't need to be the one to tell you that Harris County is really popping out on the map because of the rates that have gone up there and the average cases. So we can look, if we want to see sort of where the hardest hit areas are, we can isolate those on the map and just pick those. So now you've got a map of Harris County, of Maricopa, of Miami-Dade, and then of Los Angeles, which is helpful when you want to look at a specific range. You can change that here. And then also helpful, I think, is being able to see trends. So if you click on an area like we did with the last one, when we have other time periods of data, which we certainly do in this data set, you can look at it over time. So you have a small trend chart here where you can look, but you can also see our full trend chart, which is really informative. So this is Harris County and the changes. Obviously, it does not reflect yesterday's numbers, but that's coming very soon, like in an hour on PolicyMap. And then you can look at Texas and see what's going on as the state as a whole, and then you can look at the United States. And I hadn't looked at this graph for a while. I think the last time I looked at it, it was about here. So when I was preparing for this conversation and I brought that up, it was a pretty stark reminder of sort of the trends of what's happening. So hopefully that's helpful in your work. Now going down to the sub-county level, we can zoom in to see a little bit more detail. So let me take off that layer and let's move into Houston. Okay. So I'm going to put the streets on so that we can get a better lay of the land. Okay. And then just to give you an example of what our location information looks like, we can put on hospitals. And we can see where you all are. So I believe you are along this road. Yes, here we go. The MD Anderson Cancer Center. You can click on here and you can see a little bit more information about the hospital. We update that as often as HRSA updates their data source. So that's what our location information looks like. And then for more detailed layer information, we can see what a specific risk factor may be for cancer. So we have a number of risk factors on PolicyMap. We could look at obesity, we could look at alcohol consumption. I chose, for this example, smoking. So we can go to risk factors, alcohol, tobacco. And then whenever you see this little P, it means that it's an exclusive data set that we made. So let me take the hospitals off and then back up just a little bit so we can see Houston. a little bit better. Okay, and this is at the zip code. I want to see at the census tract. So here we can see pockets within Houston of where adults are reporting to smoke regularly. These are the areas where they're reporting more smoking. Again, this behaves just as I had demonstrated before, which is you can click on it and then you can see the comparisons and the benchmarks. In terms of risk of developing severe COVID-19, we can look at the index that we created for the New York Times. So let me load that on and then I'll talk about that a little bit. And that's what we're calling the Severe COVID-19 Health Risk Index. So the New York Times contacted us because they learned of these small area health risk and prevalence estimates that we created, such as the one that I just showed you about smoking. And they asked us to make an index of severe COVID risk factors. And this index, which you can find out more if you click this I, includes COPD, heart disease, high blood pressure, diabetes, and obesity. So if you want more information about how we created this, you can click here, and then our data directory that I just showed you has even more information about it. They featured this index in an article called Where Chronic Health Conditions and Coronavirus Could Collide. And they looked at areas that were lighting up on the map to analyze where the greatest risks were going to be. Now that was back in May, so we know a whole lot more now, but the data is still relevant, obviously. So having taken a look at these, I thought I would then show you how you can layer some of this information to really drill down within a given place to see where there may be highest risk of vulnerability. So I'm going to move over to our multi-layer mapping, just here. Again, let's look at those COVID cases that we were looking at before. And I want to look at where we have overlapping information. So if we change this again to that 7-day rolling average, and we look at where that's pretty high, so let's say 100 or more, then we can zoom out a little bit to see more of the metropolitan area and beyond. We can see the areas on the map where the hotspots are happening. That's at the county level. Now let's look at the cancer incidence that we looked at before, and I'm going to do that just by searching here. The choice. Clicking on here. And then that shades with hatch marks there. And we can narrow that down so that the map only shows where there's higher cancer incidence. So let's say, let's set a threshold of 400. So Houston lights up as being true for both of those criteria. The Houston area, I should say. And then we can add that COVID risk index, the risk for severe COVID index that I just showed you. And that gives you another hatching, but let's only look at the places where there is a high or very high risk. So you'll see the maps start to change as we take off the others. And then you can see within Harris County, let me take off the roads so that you can get a better look, where in the Houston area all of these criteria are true. So we're honing in on an area. When you click, you can see You've got a very high 7-day average of COVID cases. You've got a high cancer rate, a high-ish cancer rate, I should say, and then you've got a very high health risk index here in these areas, and down here as well. So that's one of the ways that you can use our layering tool with the various data sets that we have. The Washington Post then took our analysis one step further, and in their article, and this was about how coronavirus exposed health disparities in communities of color, they looked at the disproportionate risk of developing severe COVID-19 among Black and Latinx populations. So for more information about our work with those media outlets and our free coronavirus resources, let's see, we have a page here that has all of that information that I have shown you all in one place. So we have a COVID-19 quick maps that's available for the public. That's a little bit less of an exploratory tool and more of like sort of feeds answers. We have the news coverage from the New York Times here, as well as the downloadable data set of the risk index. You can find the Washington Post article here. And then we also have other scenarios related to COVID. So this is a reminder of how to look at that trend chart that I just showed you. We have information on telemedicine and looking at data on PolicyMap to understand where communities have internet access, where they don't have access to even a smartphone to be able to access telehealth. And then also more information about how to use our data to understand racial disparities that have been magnified by COVID-19 cases and deaths. So as I mentioned at the beginning, I did not go into all of our features. We have many others, but I find that when I talk about all of them, there's some glossing over of eyes. So I did not show our data loader, our data exporter, our reports feature, but I would be happy to go into any of those if you all have questions about that or any of our data sets. So I would like to open it up to questions now. And if anyone has a question, if you can raise your hand, I think that Zen and I will keep an eye out for any hands that might go up.
Elizabeth, I'm sorry, I'm unable to see the hands.
Oh, okay.
Yeah, but if you look in the attendee list. Mm-hmm.
Yes, yes, I will look there. Thank you.
Mm-hmm.
Okay, I see an attendee with unanswered question. Can we create a map that we can embed or share the URL and that will automatically update with the latest data? This is from Ms. Clara Fowler. I think that is a great question because the answer is yes. Unfortunately, that is not available on our new platform, but I will jump over to our legacy platform to show you how you can do that. See how, there we go. Okay. So this is our legacy platform. And the way you can do that is, let's go back to Texas for the example. And say you wanted to look at cases. And you want to zoom in a little bit more. Then you click this share button. You have a link here that you can share. And we also have an embed feature where you can get the URL and the iframe and copy that into any website. And as we update the data on a daily basis, your data on that embedded map or in the link will be updated. And I will say that embed feature is one of the first things that we're working on for the new platform. So hopefully you will soon have beautiful maps that you can share. Okay, next question. What health disparities variables besides zip code or race and ethnicity are available? Okay, great. So this is from Jessica Wong. In terms of health disparities, let me go back since our other platform is much nicer to look at. Let me go back to our health tab, where you can explore information about, which actually can be through the lens of health disparities in terms of food access. So access to healthy foods. Our parent company that I mentioned at the beginning of this webinar also has a research arm, and they have studied across the nation limited supermarket access or access to healthy foods, as well as rural food access. We also have information about life expectancy, which I think is a fascinating map, and that will show disparities as well, which you can then layer in that multi-layer map with information like people with disabilities. You can layer with our predominant race indicator to see where those align. We also have births data, prenatal care information, mortality and reasons for mortality, infant mortality, and then we also have a lot of drug overdose and opioid related indicators on PolicyMap. In terms of our health conditions, where you can look at disparities, one of our blogs my colleague wrote was all about looking at heart disease in lower income neighborhoods and how the prevalence of heart disease, which was much higher in the city of Chicago, in lower income neighborhoods. And then we have information like perceived health status, so mental health, physical health, and poor self-assessed health. And that goes down again to the census tract level, so the neighborhood level. We have some of the risk factors that we discussed. The lead exposure data is a really interesting one, which shows where there's risk of exposure to lead. So the purple areas being higher risk and the orange areas being lower risk. And then we have medical spending information. So in terms of disparities, that doesn't quite answer the question, but it does tell you sort of where people are spending more money on both medical, prescription, and then we also have overall spending as well. We have information about access to medical care, emergency room visits, medically underserved areas. So these are really helpful when looking at places within cities. These are by the census tract or the neighborhood level, and so you can see where there are medically underserved areas and where there are not medically underserved areas. And then I mentioned again the food access, but we also have we pulled out some data related to beer, wine, and liquor stores, fast food restaurants. So in terms of, again, access to healthy food and alcohol consumption. Okay. Do we have any other questions? Let me see, I think I see a hand is raised. Okay, I think that's Jessica's. Let's see. Okay. I am not seeing any other hands raised. Let me just check. Okay. Okay, so the other thing I wanted to mention is that you all have a license to PolicyMap, and so you have access to all of these features, but you also have access to other features, and I can go into a couple of those since we don't have any more questions right at this moment. So one of the features that you have access to that may be helpful for you is the custom region builder. So you can create a region if you have an area, say this medically underserved area, and you want to find out more about the people that live in that area that may be coming to your hospital. You can draw. Clicking on the map. You can save it. You can change the color. And then once you have your area, there's a whole lot you can do with that. So you can get a report, you can download data, but let's start with our community profile. So this is just a quick snapshot of the area of your interest. You can see that the region that I just drew is the one that's selected for this report. And it's going to take a bit to load, so we can go through somewhere else. Come back to this. Okay. There you go. This is how you get to the new site from the legacy site. That might be helpful. There we go. Another feature that may be of interest to you all is our health report. So let's see, let's grab one of those while we're waiting for the other one to load. So we have our community health report here. And I did not try this before our call, but let's see what it says for Harris County, Texas. And this health report is available also at a smaller neighborhood level too as well. So in this community health report, you can look at, it's a basic snapshot at the beginning, which is actually probably better than the community profile that I was going to show you. It shows you what the population is of the area. It shows you how the population is changing. You have some population growth, obviously, in that area. You can look at population by age and mouse over to see more detail about that. You can see the racial composition over time. And how that's changed. You can see small trend charts on there too, to see how the population has changed in terms of Hispanic or Latino. And then we have some more health information like the rate of dentists, primary care physicians, how many hospitals are in the area. You can see the list there, drug and alcohol treatment facilities, and then you have all the sources lined up here as well. There's information comparing the county to the state here in terms of access to health insurance and what kind of insurance. Again, there's this medically underserved map where you can download the information about that. We have disease screening and prevention. And wherever possible, we benchmark it against, say, the state or the nation. Smoking and heavy drinking, obesity and physical inactivity. And then there's some more of these. So these are really the summarized indicators that I was showing you on the map, but just in a different format. We have people with a disability, and each of these sections you can download the data, and in many of them you can download pictures of the charts that you're looking at. And then we have chronic conditions, so you can look at COPD, depression, diabetes, hypertension. And then here's the overall cancer incidence compared to the state, compared to the US. And then cancer incidence by type, broken out by Harris County, Texas, and the United States. Then we have some additional information around HIV and sexually transmitted infections. There's mortality and reason for mortality, disease related. And then you can also see drug overdose deaths here. So there's a whole lot of information in this report that's summarized if you don't want to be using the maps. We then have a whole section of social determinants of health that includes crime, educational attainment, incomes. We have information about people in poverty by age and poverty rates. Unemployment. Obviously, this needs to get updated and will be. And then where people are working, which is particularly interesting right now. We also have housing units and then the median year built for your area. Transportation, housing cost burdens, and commute types. And then we carefully document all of that information at the bottom of the report. Okay, I'm going to check for questions. Okay. Okay, I'm not seeing any other questions. I'm happy to continue. I think I saw a hand just go up. No. Okay. Okay, so I will go back. The other feature that may be of interest to you is our data loader, which is not available on our new platform, but is available on our legacy platform. So I can show you how that works. So our data loader at the current time is for location information. So if you have a set of points or addresses that you would like to map, you can upload those through our data loader. The other thing that you can do is just add points directly to the map. So let's do that this time. And then you can share it with whoever you like. I'm gonna go to the county. And if I recall correctly, I think you all are located in this area here. So let's put a couple of points on the map here. Perhaps these are food access points. And you want to know who is able to access those. You can then bring this data onto the map. And there they are on your map. And then you can start loading some of the information that I was showing you before. So if we were to look at that health risk index, right, you can see that there may be folks with a higher health risk over here who really need this, and there may need to be, rather than food access points here and here, like food pantries, there may need to be a food pantry over here. So it's a quick way to analyze information that you may have or sites that you may be considering. One way in which one of our healthcare customers used PolicyMap was for exactly this reason, but it was for siting testing tents. And so they looked at the data of who has a car and who doesn't, areas that may not be served by public transportation, and populations that they knew in their city in Florida that needed access to testing sites. And that's how they chose the parking lots that they did for setting up their tents. So information like that is available on this page that I was showing you. We have a lot of customer stories about how more healthcare customers and others are using PolicyMap to address COVID-related questions. So I'm going to check once more for questions. Okay. I am not seeing any other questions. I do see Alan Lopez, and I didn't know if there was any, if you had any questions. So I don't want to just unmute you, but if you do have a question, please do raise your hand or type it into the question bar, and I'd be happy to unmute you. I just don't want to do that unsolicited. So. Oops. Okay. Okay, so I just got a question from Jessica Foreman asking about the data loader. The question is, the data loader will only be on the legacy platform. And I'm happy to say no, the data loader will be on the new platform. And that's one of the first things that our team is working on in order to deliver that in the next, probably the next 2 or 3 months. So you will be able to see your own data. And I didn't show you, but there is the ability to upload a spreadsheet too. If you have a spreadsheet of locations, you can look at those on the map as well. Okay, and then we also have a question, is it possible to draw circles or pie chart instead of colored background? Great question. So we don't have a data visualization tool quite like that, but that is something that we think about quite a bit. But what we do have is our custom region builder where you can draw a circle around an area. So if you have an address, instead of talking about it, I'll show you. If you have an address, you can, rather than drawing on the map like this, you can create a radius around a particular address. So I don't think I have your address, but let's just do one around our home. So that shows the radius, and then you can change the size of that. So if you do a 1 mile, you can show that. I don't believe that's what you were asking. I think what you were asking was about pie charts and other data visualizations. And at this point, the reports are the place to see those. But again, that is based on what we have put into the reports. So if you have specific ideas about what you would like to see visualized, we love to get feedback like that and would be very interested to hear. Not a question. Okay, on to the next question. Not a question, but attendees are excited about this tool and asking about how we access it. Okay, so I believe that you all have access to it through your library. And I can double check on that and send a follow-up email to all attendees with directions on how to access the tool. Okay, let me see. Okay, Alan Lopez, I just unmuted you just because I saw your hand go up.
Good. Can you hear me now?
Yes.
Okay, so just for anyone who's asking that question, we do have access through the library. So if anyone goes to our library website, which is mdanderson.org/library, and we have some ads on the page, and we used to have an ad for this on our homepage, but we can think about maybe readdressing that if there's interest. But if people go to that website, they'll hover over find information, and there's an option for databases, and they can go to the letter P for PolicyMap. But also our direct URL, and I'll say this slowly, as long as you're on campus or authenticated in some way, you should be able to get this access. It's just mdanderson.policymap.com/maps. That'll get you to the legacy version that we have.
Great, thank you. And we will have the new platform available to you through this license in the next month or two. Now, that said, if anyone is really wanting to use the new platform, say for a presentation, and you need login access, please contact Alan, and I would be happy to help with getting you set up with a separate login to be able to access this if you need it more immediately. Okay, there's one
Elizabeth,
more. Yes.
Can I was kind of playing with this while you were talking. Can I just put in like a new URL to get to the new version? That's what it looked like I could do.
Yeah, good question. So we are just starting to have that available to our enterprise licensed customers. And so you actually may be able to, but we haven't done a thorough QA on it yet. So we have not emailed you to let you know that it's available. So it's really soon. It's coming very soon. But we just need to do a little bit more QA on it. So that's why I thought in the meantime, if anybody needed access to the new platform, to just contact us and let us know that, because we can give you an individual login for that. Okay, and we have another question. Is there an ability to save the data to access at a later time? Yes, there is. So you can save in a variety of ways. One of which is you have your own, exit out of this, your own account. And I have to think about your enterprise license and how it's structured. And I need to look into that and follow up with a little bit more detailed information. But what you can do is look at, oh, it's not available on the new platform. But you can access, so there is fluid saving. So whenever you save something on the new platform, it shows up in your My Saved Work, and whenever you save something on the old platform, they're all merged together. So we'll look at My Saved Work from here, but it's going to look a little nicer on the new platform. So this is the repository where you can save maps, you can save information like reports. If you did one of those multi-layer maps, you can save those here. You can save your custom regions. If you uploaded data, you can access it here. If you shared any data, you can get those links again. And then if you downloaded any data, which I should probably show you now, you can get that here. You also can create projects. So there are many ways for you to save your information. But as someone who works on data, I always want to just get data for myself. So what I do is I download our data. And I'll show you how that works. So if you're interested in looking at, let's go back to cancer again, cancer incidents. You can download this information for whatever area that you choose. So you click on that download button there. You have your layer here. You can pick for what you want to download the data. And if you want to, say, get data for all of Texas, you can change that here. And then you can download it by county. And then when you click here, you will get a CSV or a file that you can open in Excel. And then you can sort the data in whatever way you want. Another feature that is, so here's your data that then you can save on your drive. Or you can put in another tool if you want to visualize it, say in Tableau. But another feature that we have that might be interesting to you all is the ability to look at, say, where address level data, like hospitals, for instance, just in this example, sit, and the cancer rates in the areas in which they sit. So this is what we call our point with layer data. So in this example, you have the cancer rate data for each hospital location. So again, let's look at the state of Texas. And get that county level data. And then what you're going to get is for every hospital, you will get the county cancer incidence for the county in which that hospital sits. So that sometimes takes a little bit longer. But that's another way to save your data. So I'm just going to look for any more questions. It doesn't look like we have any, and it looks like we're coming upon the end of our hour. So one thing that I always like to mention is that we are always open to answering questions. We love answering data and mapping questions, and we love getting suggestions for data. So if you have data that you'd like to see on PolicyMap that you're not seeing, please do let us know, because we would love to investigate it and possibly add it. So thank you very much for the time together. I hope this was helpful for you all, and I hope that you will reach out with any questions about data. And if you need any additional information about access or accessing the new platform, we're happy to help with that as well. So thank you very much.